Thank you, Chairman Dr. Schwartner and Health and Human Services Committee for listening to my testimony today. Thank you for your careful consideration of time and for your service. My name is Adrienne Trigg. I represent myself and a grassroots group, Protect Texas Fragile Kids. We represent thousands of Texas children that require round-the-clock hospital level of care. And my son, who you may recognize or remember, was a page for Senator Watson earlier this month, and is not here, but is with his private duty nurse and is out of the hospital. I'm from Austin, Texas. Dr. Schwartner, I do not believe now is the time for step therapy to be transitioned to the MCOs, as there's not enough safeguards established for the new MCOs, as they have been testified about recently in the House Bill 1917, as well as other documented problems in other states such as Ohio by the state auditor and numerous media sources documenting how MCOs have failed families like ours. My son was recently prescribed a coordinated effort of specialists had prescribed through his infectious disease doctor, his surgeon, for antibiotics to treat his chronic infection. And that surgeon prescribed this, has had 20 years of experience and never prescribed this recent antibiotic. The newly prescribed antibiotic is called SAS, which I'm sure you're familiar is surgical antiseptic solution, which is a wash which will be administered through a stoma directly into his abdomen. It has taken us since January to find a pharmacy that can sterile compound it and can be administered outside of an OR. My son continues to fail numerous other traditional antibiotics. By going through a sequence of antibiotics and step therapy, you can develop antibiotic resistance. The bacteria can grow stronger and can break through traditional antibiotics. With step therapy, it would only delay the appropriate medical treatment, resulting in possible hospitalization of fragile children. We do not have the luxury to wait 24 hours or 72 hours for exemptions to be determined from MCOs. Dr. Buckingham met with the President Trump last week regarding health care, and I agree, as her constituent, that insurance companies should not be getting in the way between doctors and the patient. And I believe this bill does just that, as many of the MCOs have proven to not offer continuity of care. As a parent, please help me understand how step therapy is beneficial for families like ours. Thank you.
Thank you for your testimony. Any questions? Justin Hudman.
Justin Hudman, Texas Pharmacy Association. I'm here to testify today on the bill. I'm also speaking on behalf of the Texas Pharmacies Association, Independent Pharmacies Association. I'll be considerate of your time and be brief with my